emerged that more than 20,000 letters or emails, which should have been sent to Worcestershire GPs after their patients attended hospital, were in fact never dispatched. Worcestershire Acute Hospitals NHS Trust has admitted it's now investigating the backlog, which dates back to 2011. It says some patients may not have received the follow-up care they should have. Well, our health correspondent, Michele Paduano, is here now. So, Michele, when did this first come to light?
We're not sure exactly when, but I understand that they knew about it in June, and I was contacted by somebody who was concerned that they weren't being transparent enough about getting this into the public domain. So as a result of that, I saw the chief executive on Monday and I asked her the question as to what really was going on.
The system itself is a bit unusual, I suppose I'd say. Apparently, as I understand, you hit a button that says send, but you actually have to hit a second button to actually complete the sending of that electronic document. So there's a bit of probably user training that we need to absolutely take on board. To date, we haven't had any harm identified yet. Of course, if that is the case, we will review that in those cases as warranted.
Well, no doubt you've been speaking to some GPs about this. What's been their reaction?
Well, we were expecting somebody to actually do an interview tonight, but unfortunately they were detained elsewhere, and we were expecting to do an interview tomorrow, but a press release was put out this afternoon on this matter. But they've been saying that this came to light because a particular GP, Dr. Simon Parkinson, actually received letters that were over a year old, and that's what started the ball rolling. They said that of the 22,000 letters, 11,000 or so have been sorted and found not to be at issue. But they say there may be a small number of these letters where patients have come to harm because they have not been diagnosed. And there will be this process going through to September where they'll be analysing these letters, with the most important ones being looked at first.
So inevitably some patients are going to be concerned. What would their advice be to them?
Well, the advice to them is that they will be contacted by the trust if they are in a position where they need to be. But if they are concerned, they can call the PALS on 0300 123 1732. That's 0300 123 1732.
Michele, thank you. And